Signs of autism can be observed as early as 6 months to a year old in most cases, although that diagnosis of autism doesn't typically occur until at least 18 months of age. There are certain signs and symptoms that professionals can observe as red flags to determine if your child may possibly be autistic and to get an earlier referral to the right professionals to diagnose that. It's important to remember that I'm going to list quite a few characteristics, and just because your child has 1 or 2 or 3 of these characteristics does not constitute an autism diagnosis by any means. However, if they do have some of these characteristics and you're genuinely concerned, it's definitely something not to ignore, because all the studies show that early intervention is the key to improving the signs and symptoms of autism, and in a lot of cases children can make so much progress that even a very severe case of autism can become very mild with the right treatment and expertise. One of the characteristics that we see in children with autism is poor eye contact. So even at 6 months old, even at 3 months old, an infant and a child are very interactive with you. They'll look right at you when you're cooing at them or when you're feeding them. So if they're not doing that, that could be a sign of autism. Another one is poor play skills, and this could be the child where if they're playing with a ball toy, the 2-year-old ball toy where you put a ball in and it pops out and the kids get really excited every time, then instead of doing that with a ball toy, they'll take the ball toy out and tap the ball or twist it kind of incessantly. Something that's not necessarily a functional use of that toy. The child that instead of running the car back and forth, going vroom vroom, they'll take the car up and kind of observe how the light's hitting off of the car or what noise the wheels make when they spin versus using that car in the way it's meant to be used. So those are some skills that would be characteristic of possible autism. Another one is poor affect. So it's hard to tell what they're feeling based on their facial expression, or sometimes they have a really difficult time regulating their emotions. So they'll go from crying incessantly to being elated and happy in the matter of minutes. And the hallmark is that you can't really determine what caused that emotion. Another one is repetitive behaviors. So kids who do the flapping, that sort of thing, or sometimes they'll rock back and forth. Sometimes they'll tap a table just incessantly and you don't really know exactly why or what the reason is. Another one is they can have hypersensitivities to things, so sensations. So this would be the child or the adult who every time they hear a toilet flush, it's almost like an assault to their auditory system. So even though you've explained to them that, honey, it's the toilet flushing, it's going to happen every time you go to the bathroom, it doesn't get any easier for them to process that information sensory-wise. One of the main characteristics and the hallmark of autism in every case is ineffective or poor communication. So this is the child who sometimes will produce what we call echolalia. That's where they repeat something versus answering a question. So if you say, do you want milk? They'll say, want milk? Want milk? Instead of saying, yes, I want milk. So it's ineffective, poor communication skills. So those are all signs and characteristics that are red flags for autism. So if you do have any concerns, if you see any of these signs or you feel just a gut feeling that your child may be exhibiting some of these signs, I would definitely recommend calling your local speech therapist, talking to your pediatrician as early as 6 months. There's no medical test that can definitively confirm or rule out autism at this time, so we diagnose it based on a conglomeration of these symptoms and how these symptoms negatively affect your child's development.